Some people treats disease, some other treats patients, and there are very few individuals who treats suffering itself. They see the fragility of the life and respond with complete compassion, care, and courage. Myself, Fatima Mehek Adam. I'm an Erasmus Mentis, NOHA joint master student in International Humanitarian Action at University of Warsaw. Today, we have an amazing guest, who is a real gem, Dr. Janil.
Thank you.
He's a pediatric cardiac surgeon trained in New Zealand. He could have chosen prestige, comfort, and staying in a very steady career. But he chose something very different, working in some of the toughest zones in the world. Starting from Zambia to Nigeria, Somalia to Iraq. He worked in different areas, providing life-saving support to children. So through Better Heart Foundation, he's not only saving lives, but he is actually building a team, empowering local people, and also creating a sustainable path forward. We are so happy to have you here, and it's been a great pleasure for me to have a contact with you and talk with you. So welcome to our show.
Thank you.
So before we dive into your medical career, I'm a bit curious to know about your early age. What really helped you or shaped you to come into this particular area?
So I was actually lucky to born with a family with a lot of doctors. And since we had a hospital, my father had a hospital, we used to get contact with a lot of doctors. So as a young kid, I used to be very close with a pediatrician who used to tell me about the need for pediatric cardiac for even at that young age. Beyond that, the kind of value you have as a doctor in a society and the kind of respect you get from the people, that kind of influenced me, and I wanted to become a doctor, even though I was quite interested in maths and science, and there was a feeling that I have to be either a scientist or a doctor. So
that sounds good. So we know that medicine is calling for many, but not everyone is drawn to it. So I really want to know what actually made you to choose this particular path.
So I should say the contact with this pediatrician and the kind of, I used to sit in his OPD many times, and he used to tell me that many kids have to travel quite a long distance to get their procedures done. And he kind of influenced me, and also there was quite a interesting incident in my life when I got my entrance examination and I got through. The rank was not that great, so I was still thinking, I hoping to be a scientist because the rank was not that great, and I ended up in Manipal. So I kind of reached Manipal with no certificates, no money, no papers, and I met this guy called Ausap, and he kind of helped me initially through that process of getting through the examination, the counseling process. And that was my turbulent entry into the medicine. And from there, it was a lot of fun during the medicine part, but also there was a thing that, this is something I wanted to do, and I wanted to continue to do excel in medicine, how much possible with me.
For me, this is something new as well as something very interesting to know that you really want to be a scientist, but right now you ended up being a doctor, and it sounds amazing. Anyway, I really want to know, heart surgery for children is one of the most intense area, I guess. And you now ended up choosing pediatric cardiology, which is like something really complicated at some point. So I really want to know, what was your reason behind this choice?
So interestingly, pediatric heart surgery or heart surgery for children involve a lot of mathematics, because you get kids of different sizes. So you need to have these calculations very quickly in your mind. So somebody with an interest in maths, this is one of very good profession if you are entering medicine. And also a lot of things are structural problems. So you are actually correcting the structures. So beyond that, there is a lot of innovations also required. So you have to, because this pediatric cardiac surgery is kind of complex because it requires a lot of people. So we are also trying to simplify the thing, how we can simplify a complex process. So all these things, it kind of helped me, coming to with this scientific mentality kind of helped me, I think, to navigate through this tough profession.
Okay, perfect. So if someone is interested in Max and really want to go with medicine, I think this is one of the best option for them. Okay, thank you for that. So now you achieved your course, and I really want to know what was your first step towards your professional journey, or how you started your professional career?
After doing my medicine from Manipal, I did my surgery from Bangalore Medical College, and then it is cardiac surgery from the Calicut Medical College. So kind of my journey was quite fast because I was already decided on taking up the pediatric cardiac surgery. So I didn't have to waste time thinking about which one to choose among the specialties, because that's one of the main confusion among medical professionals once they finish one course. So Calicut Medical College, I did my cardiac surgery, and during that time, that was the time the cardiac surgery kind of expanded in medical college. So before that, to 2007 I joined. Before that, there was only 30 to 40 surgeries a year in a college, and from 2008 onwards, we started doing around 300, 350 cases. In spite of that, there was only 1 or 2 children surgery which has been done. So I worked with Dr. Kuriakos, one of the head of the department of cardiac surgery at that time, and he kind of told me that Janir, if you are really interested in pediatric cardiac, should go and learn from somewhere, and you should at least perfectly know how to treat at least the simple cardiac surgeries, pediatric cardiac surgery safely. So that was my first motivation. So he said, you should go away from here, learn, and come back to the city.
So I would like to know, is there any unforgettable memory or any case in your professional career that you can actually share with us?
So there is quite a few cases which comes to my mind, but since we started from my medical college days, so one of the interesting case was a young boy, maybe I think around 1 year and few months. And he had a condition called tetralogy of Fallot. It's quite a common condition where your blood supply to the lungs will be quite less because the vessels, the path from the heart to that lung vessels is narrow. And one of the way the child naturally increase the blood flow to the lungs is by clamping himself down. They will have to fold both the knees and the elbows, and this child was like that in the bed, and we informed our current, the then boss, Dr. Kuriakos, and even though we were not doing pediatric cardiac surgery much at that time, there was no other option for this child. So he said he had some training, and then we will do it. We'll do it or do our best. So we all got together for that child. We did it, and the child did very well, and so that was something which inspired. I know, and we could make a difference to a lot of children like that if you have good training and how to manage even difficult ones than this.
So this is something amazing what you did, and what you're already doing is like, for me, it is really good. So I really want to ask you something, which is, now you got a very good start, like working in some of the top institutes with advanced facilities. But now you just switched from being here into a different area. It's like breaking your comfort zone, traveling into a very difficult region. So I really want to know what really made you to go into this particular area.
So immediately after that medical college incident, I wanted to join some premier institute. So I joined Apollo Chennai. It was one of the most premier medical institute, private medical center in India. So there, but the pediatric cardiac as such in India was just developing. So even in such a premier institute, once I joined, I realized that there is still a lot of lacunae. So I kind of got to know that the people go abroad for training, and the Apollo kind of helped me go to New Zealand for further training. So after 2 years in Apollo, I went to New Zealand, the Green Lane, or previously called Green Lane, now called the Starship Children's Center. And it is one of the first heart surgery in the world. So there was lot of experiences there. So I could see, the patients which are operated in the 60s to 70s. And also they've been, since because of their long experience, they had actually perfected their art. But I always wanted to come back to India, because that was my primary aim of even going to New Zealand to learn more about how to treat these children. And huge number of children were waiting for procedures during that time, even in India itself. So I kind of joined Aster City first, and then again moved back to Polo Chennai. And we had a wonderful program for next 5 years. We went to every nook and corner of Tamil Nadu. We conducted a lot of camps. We did a lot of cases. And there was a particular month we even did around 150 cases, including the pediatric cardiology and surgical procedures. We kind of combed Tamil Nadu. We finished off all the pending cases by 2019. But then again, during that time, I used to get in contact with a lot of African patients. A lot of international patients used to come, and a lot of international doctors used to come and train with us from Nigeria, from Ghana, from Somalia. So all these doctors, having seen our work, they wanted me to go there and help them also. So one of the, especially the one from Somalia, he was not leaving me alone at all. So he used to take me to the coffee shop and tell me that, Somalia, you should come. It is not that dangerous. I was very scared at that time. So then he used to show me some videos of doctors coming, and then it's possible to come. And he said, the Western people are coming. You can also come. It is not as you've seen in the news. And one of the videos he showed, there was one of my friend in the videos. So then I called him up, and he said, he asked me this question, are you watching BBC Africa? Because how did you know I'm in this place? And then he said, you come immediately here. I said, why? I think all are your kind of cases. I don't know what to do. I somehow made some excuse and told them to wait for 2 days. So you come tomorrow. Then I asked, how can I come tomorrow? But it's okay, we'll arrange everything for you, visa, travel, everything, you come. And within 2 days, I am there. And even my friend Somalian, I did not know, he was also there through some other flight. By the time I reached there, he was also there. And the first OP, the OPD, the outpatient department, that kind of, there are around 120 patients in that one particular OPD. So then I realized that, this is where you have to do a lot of work. This should be the place where we should be starting to do something.
120 cases in a single day is something very shocking for me. And I think it's one of the most complicated situation. And I really want to know what happened next.
So even though there is so much of work, we can't do all the work in one single day, because we did a lot of planning. Also, these are developing countries or underdeveloped countries, and we have to deal with people's emotions, public perceptions, the scarcity of the labor, or the doctors or the paramedicals who know how to treat children. So we have to do it this very intelligently, because any one single step, any small step, you are not losing one child, you are losing hundreds or thousands of child, because they will not let you come again. So we had to have a very meticulous planning to get our first program through. That was the biggest challenge. So I kind of planned, and I got around 5 extremely good professionals from India, various parts of India, because I told them the resources are limited and you have to give results. And somehow we Indians are much better equipped to do these procedures in resource limited areas, because of our kind of experience from resource limited to now reasonably resource area. So we have learned this. Most of our doctors or the paramedical staff know how to deal with both resource limited areas and when you have the adequate resources. So that was our first trip, and we did around 15 cases. All went very well. And even though we came back, the hospital called, the president came, and it made a big noise there. It improved the public's confidence in pediatric cardiac surgery. So that is how we begin our program. And then from there we took it on. We did around 400 pediatric interventions, and now we have started doing some surgeries also there. And few patients, around 25 to 30 patients, came all the way to Calicut. So we did the surgery here, and we sent them back in a healthy or as a healthy child.
So I'm so happy to know that medical professionals from India is doing a great job in a different country, right? So how are you organizing this actually?
From the first, we did around 400 cases, but the requirement in Somalia, every year around 7,000 children are born with congenital heart disease. So we are just scraping the surface. And even from when I said from the first OPD, 120 patients or, total of 300 patients were there in 3 days. And we could do only 15 cases. And many children did not make it because they cannot wait for so long. So I needed to have a more comprehensive plan. I needed to have an organization. I needed to get funds. I needed to get people to work with me, the nurses to work with me, the skilled professionals to work with me. That's when I decided to form this foundation. It's basically we are a group of doctors from various parts of India working in different institutions who collaborate to do these missions every once in a while. But as I formed this organization, I am thinking of even a bigger group with a lot of volunteers and a lot of skilled staff for the organization itself to do this program around the world globally as a the regular job itself, not just as a part-time missionary work. For making a sustainable program, and we also realized that we can only make the system better. So that was our concept. It is not we are not aiming for perfection. We are making every children or every child heart better. With that idea, we formed this organization called Better Heart Foundation. Our aim or our mission or the vision is to make every child heart better. And with that, everybody who is watching, to bring them smiles, make their heart also better. And please continue or please support us in our journey to make every child heart better.
So you are doing a wonderful job, but at some point, I find it so difficult to find the most needy people in our society. So what do you felt about that?
So it is not just in Somalia or Iraq we do our work. Most of our actual work is still concentrated in India, or our main work is still in Calicut and surrounding areas. So we do conduct lot of peripheral clinics. We go to, like for example, Calicut is the metro city or the tier 2 city in this area. So we go to Talasheri, we go to Kalpetta. So basically, one of the things which is coming to my mind now is when we went and started in our first clinic in Talasheri, IGMCC. So there was two tribal ladies from far off region near Eriti. So I saw the child needed a procedure. So I explained to them there was a requirement of procedure, and I told them you have to come to this particular place. We will try and arrange funds for them. And looking at their face, I realized that it will be difficult for them to even understand how to come, how to come by a bus. In fact, I asked them, how did they come here to Talasheri from Iriti? They told me by taxi. Then I asked, like, they looked quite poor, and how did they manage to arrange a taxi? Then the people from their villages arranged the taxi for them because they couldn't travel. So we contacted the ward member thing, and they arranged for a transport for the child to come to the hospital here. Child underwent a successful surgery, and 1 month later, they gave a big warm welcome for our entire team for the village, and with small mementos. So we do conduct these camps. We do reach out to areas in need We have conducted camps in even not just in Kerala. If you go to the border region, to Gudallur or towards the Karnataka, Sullia and Virajpeta, or the Kodagu region. So all these areas, wherever the need is requirement is there, we go there. In fact, working in these areas has helped us do this work in Africa.
So, as you're working in a completely different continent, I think it's completely different from India, especially the economic, political, as well as cultural situation. So, what are the challenges that you ever faced while you were working in the field?
Basically different, you have to deal with the different people differently. You need to observe them, you need to watch what they want, you need to understand the environment which you are working in. You need to have some sort of a political support when you are working in these areas. Also, different people behave differently. Now, when you go to an Arab region, there's a different way they are proud of themselves. And when you go to Somalia, there is different, because you cannot always judge also by the looks also. So I remember a particularly around 30-year-old father, the look very young father with torn shirt, looked quite poor to me, and got a child who needs a procedure, which at that time we had all the equipments to do that and even the consumables to do that. And the way he was dressed, he was the torn cloth and the way he was looking, I was little skeptical to say, this is going to cost this much and whether he'll be able to arrange funds. We actually do this as a mission. So we go off in 2 days. Everything has to be arranged in 1 or 2 days. So, but still, as a doctor, it is our duty to tell what it actually takes for that treatment cost is there and what are the risks and benefits. So, I told him, I think approximately it was around 3,000, 3,500 for the procedure at that time. And he said, okay, but I wasn't expecting him to come back. So 1 hour later, he came back with a lot of soiled currencies amounting to around 1,000 to 1,500. And he asked me that, can you do it for this? This is what I have. So I immediately called our, the organizers, the hospital management, and they told, I told them that, there is this child and they desperately wanted to get it done. So, and then the hospital management was happy to support that child. He said, we have now enough things, we have some extra funds, we can utilize that and we can get it done. So many times we get this, sometimes the parents don't tell us. It is because of the funds or lack of funds they are not doing. So it's always easier for us if they come and tell us this is the problem, or this, or as much as if they can communicate with the foundation, it will be easier for them. Sometimes it may be just the fear, or sometimes it may be lack of understanding, or sometimes it may be funds. So only if as a foundation we understand their problem, we will be able to help them.
So, now we listened to many successful stories that you shared with us. So, I would like to ask, is there any heavy heart story that you want to share with us?
There are quite a lot, or even though it's not in big number, the thing is, more than the success stories, it is this difficult and which gets stuck in our mind, because these are the things which teaches us, which we introspect, which we try to modify. So any sort of difficult cases, actually as doctors we say, we never remember any of our successful cases. We only remember our failures. We always forget almost all our successes, but even one or few failures which get stuck in our mind. And there are times, just because of lack of funds, we were not able to do it, or we had this borderline funds, whether we can do it or cannot do it. So a lot of few cases are there like that, even in here, even in abroad. So even this next trip which I am going, I'm going to Somalia in another week's time. We were supposed to do around 7 children. Unfortunately, by the time we went, only 3-4 children was able to arrange funds. So these things sometimes hurts us, because sometimes they have some funds, but we think that if we are anyway going for the team, with a little bit of help, we will be able to help more children, more people. But this is part of our journey. So we'll have to accept failures in funding, and sometimes, very rarely, we may not be able to achieve full correction. We'll be able to do. So it's always our aim is to make things better, but this is a very sensitive field also. We do have failures. We call it, 1 to 2%. Things doesn't go according to what we plan. But as a team, as a group, we have had success more than 99%, because we take most of the people who comes with us are actually very good, with lot of
That's a big
experiences.
number.
Yeah. Yes, because we take very good clinicians or very good skilled people for our trips. That is why we were able to get this kind of an excellent result. But still, we do need more people, because we are expanding. More and more people are coming to us. So we need more funding. Also, we need more than that. We need more skilled people to join us in our mission to make, again, every child heart better.
Exactly. As you're doing a very great job, I hope you get more people, more fond to change these kind of stories into successful stories.
Thank you.
So now I know that you are into making something big and novel.
Yeah. Hopefully, because from Somalia, our journey took us to Iraq, where we almost did around 200 cases already. And we also did a program in Nigeria. We have our setup in Tanzania, trying to mature. And there is lot requirement. So even in Tanzania, there are 15,000 children require procedure, where only around less than 1,000 children are undergoing procedure. So every places, I think there are a lot of requirements. So the Better Heart, whatever we are going to do is only the 5% of the work, but still it makes a lot of difference, because for every parent, the child is important. So even if you can treat one child, that itself makes a lot of difference. So our aim is to make every child better as much as possible, as much as our capabilities increases. So we have tried to do it from our heart, whatever possible, to make it happen.
So I really want to appreciate you for doing such a great thing. And it's something really, really important, especially in this current scenario, working in some of the toughest region. And I hope you're going to have a very amazing journey forward. And thank you so much for joining.
Thank you.
Every child's heartbeat is a story waiting to be written. If you find this video insightful, join us, share this episode, and support us. And if you want to be a part of this team, please go through our website for more information.